Vice Chair of Homelessness, and I work at the Eugene Chamber and sit in the business seat.
Hey everybody, Paul Solomon, Director of Sponsors.
I'll step in, Commissioner Pat Farr, Lane County, and I'll tab Sheriff Harold.
Hello, all, Cliff Harold, Lane County Sheriff. I don't know who to pass it to. Mike Fleck.
Hi, Mike Fleck, Cottage Grove City Councilor and representing the rural elected position. And gosh, I am sorry, I don't know who to pass it to.
Well, let me step in because I have to step out of my office real quick. I'm Julie, Hope and Safety Alliance, and I am the Victim Services and Survivor Representative on the board, and I'll be right back.
I'll go next. I'm Sean Van Gordon, Mayor of Springfield.
I'm Matthias, Homeless Youth Representative.
I'm Donna Butera, Bethel School District McKinney-Vento Liaison.
I'm Dr. Willie Foster, the Healthcare Representative, Occupy Medical and Black Thistle.
Cheryl Balthrop from the Eugene Mission.
Susan Lopez, I'm with Child Welfare, but I also represent Victim Services and the Youth Homelessness Solution Chair.
Dave Haverland, United States Department of Veterans Affairs.
Sheila Wagner, Oregon Department of Human Services, Self-Sufficiency and Child Welfare.
Debbie Farr, Trillium Community Health Plan, CCO.
Jacob Fox from Homes for Good.
Catherine Ryan with the Pacific Source CCO.
Hi, everyone. I'm Eve Gray. I'm not technically a member, but I'm the new Director of Health and Human Services. So wanted to just introduce myself.
Welcome, Eve. Great to have you. Anybody else want to jump in?
I'm Steve Manella. I'm the manager for Human Services for Lane County and staff here.
And Kate Budd, Housing Manager with Health and Human Services, Lane County.
Excellent. Okay. If you didn't have a chance to introduce yourself and you'd like to, you can go ahead and put your name and association in the chat. That'd be wonderful. So, admittedly, we had a land acknowledgement planned for the beginning of the meeting, but I don't have a copy of that. I think Chris was going to make that land acknowledgement. So unless one of the staff have it pulled up and you guys would like to do it, that'd be great.
I'm glad to. And want to thank the city of Eugene for this particular Indigenous land acknowledgement. And also recognizing that folks are joining us from other cities than Eugene, but specifically for Eugene. It is built upon the traditional homelands of the Kalapuya people. Today, descendants are citizens of the Confederated Tribes of Grand Moran Community of Oregon and the Confederated Tribes of the Siletz Indians of Oregon. We acknowledge and respect the inherent sovereignty of all federally recognized tribal nations, those who are not federally recognized, and those who continue to make contributions in their communities here and across the lands. Please join me in a moment of reflection.
Awesome. Thank you, Kate. All right, so we do have a little bit of follow-up from our previous meeting and a consent agenda to pass. I want to acknowledge, and I know that, sorry, phone's ringing on my computer here. I want to acknowledge, and I know Mayor Venice isn't here, but she has been an advocate for us to do a little bit of a deep dive into our financials as a poverty and homelessness board. And so I want to call out that later in the agenda, we are going to do a little bit of a fiscal deep dive. We do have January financials included in the consent items, as well as minutes from December. So if there is a motion to approve those consent items, we will do that and then go into the kind of a deep dive on the financials in just a few minutes.
A quick Warner.
Moved.
Okay, I second.
We got firsts and seconds all over the place. All right. Hopefully one of the staff caught that. All right. All those in favor of approving the consent items? Raise your hand, wave, dance up and down. Excellent. Anyone opposed? Abstentions? Excellent. All right. Those pass. So we're going to kick it off with some committee reports. And Dave, you are the first on the list here from the Employment Committee.
Thank you, Madam Co-Chair. Dave Haverland, United States Department of Veterans Affairs, co-chair or chair of the Employment Work Group. I just want to acknowledge the tremendous amount of work and support by all of the members involved in providing vocational services and job search assistance to the community members at large. A lot of work's been done in a sub-work group from this committee around transferable skills, diversity and equity, lived experience. We've got folks from DHS involved in that, nonprofits, just a whole lot of work around trying to figure out exactly what to do as a committee to impact change for those seeking employment in our community. And having said that, we're gearing up towards our 2023 to 2028 strategic planning and figuring out what we can do and embodying a cultural shift, and then going after funding for potential training and whatnot. I have written remarks that I can submit to the chair. Thank you.
Wonderful. Thank you, David. I appreciate that. And it looks like shelter. So Chris is not here, but Dan?
Yeah, we have been getting reports from the county on the new project up on River Avenue, the Navigation Center. Sarai could give us more, or someone else from the county probably could give us more update, but my understanding is they're still working to get that up and running this summer. So that will be an exciting addition when that gets going. I think many of you are aware of the safe sleep sites that are in progress. Everyone Village is now up and running. I think I heard that they have 30 or more people now on their site. Square One Villages is working to get theirs up and running starting next month. A few other smaller things we've been getting reports on, but I think that's the gist of most of our attention here the last month or two.
Excellent. Thanks, Dan. Healthcare Committee, Dr. Willie Foster. Oh. Dr. Foster, are you still there?
Yes, I am. I had to unmute. So yes, we've been meeting. We had a very good presentation from the two CCOs about, what they can and, can't do for unhoused populations in terms of healthcare. And that was very informative. We're continuing to work on medical respite. It's a slow process, not as fast as we'd like it to go. Another big thing we've been working on is just, coordination of care between hospital and different service providers. So yeah, the healthcare committee is moving forward. We have a good group that is very involved.
Excellent. Thank you, Dr.
Brittany, I
Foster.
have a question if I could chime in.
Yeah, go ahead.
So first, I just want to publicly acknowledge the tremendous work that Dr. Willie is doing in healthcare for the unhoused locally. He is just a treasure. Separately, I wanted to raise the issue to see if anyone can provide further information as to when the county will be distributing the COVID tests to congregate shelters. We have received a few outdated tests, but we're looking to receive, I know the state received the 12 million tests, and I know Lane County is our local distributor, but we are in desperate need of COVID tests, and we're hoping to learn more and to really advocate for receipt of those tests. Can anyone advise?
I would be happy to reach out to Steve Adams, our incident commander for COVID, who has access to the tests that we have, and ask him to reach out to you.
Thank you.
Excellent. Thanks, Eve. All right, we'll keep going with committee updates, and then I'm going to circle around at the very end to see if there's any questions or additional comments people wanted to ask from the chairs here. So we have a new coordinated care, coordinated care committee. And James did give me a note, said the co-chairs are Dr. Foster and Mike Fleck. So Mike, are you able to give an update on that committee?
You bet. So I believe in your package, you have a list of the folks that we'd like to appoint as voting members of this committee. It was James, Dr. Foster, Soraya, and I met. We tried to make sure each agency was pretty evenly represented, along with others, that were appropriate for the other spots. This is, I think, a good list of folks as, of course, a starting place. I believe that, if I understand, James, help me please, but this board needs to approve that list. Is that correct?
That's correct. And I also just put in the notes, it is the Coordinated Entry Stakeholder Committee. It was wrongly noted as a Coordinated Care Committee. But yes, that is correct. We're looking for approval of the nominated voting members.
Excellent, thank you. So I wasn't crazy by thinking it was coordinated entry. Appreciate that. I'm just checking the agenda really fast to make sure there wasn't somewhere else on the agenda that we were going to do that approval. Kate, is this the right place for that?
It is, yes. This was a later addition, and you will find the list of the members on page 7 within the PHB packet that was sent out just a mere few hours ago today.
Okay. Perfect. Well, can we get a motion from the group for those nominations?
So moved.
I'll second.
Great. All those in favor of approving those folks for the Coordinated Entry Stakeholder Committee?
Aye.
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 Any opposed? Abstain? Excellent. Thank you for sending those over and for getting that committee up and running. We appreciate it. All right. Julie Lambert, are you able to give us an update on League?
Sure, absolutely. I'm Julie Lambert, and I'm with the Lived Experience Advisory Group for Unhoused Engagement, and we still have more than one iron in the fire that I would like to share. Our projects have included developing a strategy that could be in print and or digital form that's very simple tool for navigation, starting from homelessness to being housed, so A to H, as well as a copy of rights and laws around being homeless or unhoused, and digital and wallet-sized print. We have presented our ideas to other groups, and they have been met favorably with some interest in collaboration. And we're also working with others on a provider dashboard. And Sarai has an excellent rendition of what we eventually would like to see our project look like. Coming up, we will be directing our energies towards facilitating the difficulties that people who have lost their housing or are in danger of losing. Thank you.
Excellent. Thanks, Julie. Membership, Sean Murphy. Any updates? Sean on here.
And that group hasn't met recently, so there may not be any updates.
Yeah, and I don't look like I see him on the call. All right, youth homelessness, Susan Lopez.
Yeah, we are very, very busy working on our coordinated community plan for the youth homeless demonstration grant funds that we received. We should be presenting something in the next little bit to the board for approval. We have had multiple all-day convenings to map out, do some system mapping and planning. And Matthias, if there's anything I'm missing, feel free to jump in. I've been amazingly impressed by our youth leadership in all of these meetings, and we're really excited about what we're working towards.
Co-Vice Chair Quick Warner, I have a question.
Yeah.
And this is for you, Susan, and maybe for you, Donna Butera. We have the ongoing meetings for the YDHP, the Youth Development Grant. Is there an update you want to give on that, how that is going? Because that is pretty exciting. I've attended some of those meetings, and I know, Donna, you've been closely keeping track. What can you tell us what's happening there?
Well, Susan did speak to that a bit. That's partly what you said about the coordinated community plan. And it's been very time consuming. There have been numerous meetings with these facilitated by these national groups. And right now we know that we do have this deadline for the coordinated community plan coming up. And that's been the focus, to get that, all the pieces of that put together. And it's really coming together nicely. And Jenna Ellie is now in that position of coordinating the effort there. I'm not sure of her title, but that's moving forward quite nicely, I think. And I agree with Susan that the input from the youth leaders, both from two different youth groups, one from 15th Night and one from Looking Glass, have had a lot of input. And so that's really been the focus. There have been a lot of discussions, and I think we're really getting pretty close on that. There is an education component. I've been sitting in on those meetings as well, and just really trying to define. Right now, we are at the place of really trying to decide the types of projects we would like to prioritize with those RFPs.
Yeah, we have one more session this evening for system modeling for youth under 18 that we'll be working towards. And then after that, I think then we get into the business of looking at the system modeling that we did over 2 weekends, where we map out what kinds of service arrays and what kinds of services we would like to prioritize. And then we'll be voting and making decisions about what kinds of projects we would like to fund. So yeah, sorry to jump in there, Donna.
That's absolutely fantastic. What I really wanted to underline is the amount of work that's going into that. That's a 3-hour meeting tonight. It was a 3-hour meeting last night, and I think maybe 6 other meetings prior to that. So excellent body of work.
And there were 4 full days of planning too. Both of those sessions were a Friday and a Saturday, so that we could accommodate youth schedules as well. And that was just the 2 intensive sessions, and there have been numerous other sessions. So it's been eye-opening for me in terms of time that's gone into it.
Excellent, thank you.
Any other questions, clarification, comments from folks? I did have a couple on the employment committee. So there was a Dave referenced a subcommittee of the employment subcommittee that gathered to talk a little bit about workforce opportunities. And I had the chance to meet with Heather Silicki and a couple other folks, Ashley Espinoza, Deanna, and we were kind of talking along the lines of how to get businesses more involved in that conversation. And the chamber was doing kind of a convening with businesses around this workforce issue. And so we kind of combined those conversations and had our first meeting this last hour, and had about 25 folks, mostly private businesses, who are excited to get involved in that conversation. So I'm grateful for Deanna being there and helping us to make some of those connections. And I think there's some good stuff that'll come out of it. And then Julie, on the league side, we have a group of businesses who are putting together, with the help of the city and county, a resource guide for businesses who are having some impacts of some of the unhoused and unsanctioned camping. And their ask is for resources to be able to give to those unhoused individuals if they do encounter them in the mornings when they get into the office. And so I would love to connect with you for whatever resource you're putting together for us to help be a conduit for getting that information out to unhoused folks too. So trying to connect some dots on the things that we're all working on together, and appreciate it. Okay, looks like jurisdiction reports are next, and this was a relatively new agenda item we wanted to add to provide the opportunity for our government jurisdictions to give some updates as well. And Sean, I don't know if you were communicated with in advance if you were going to give a report, but we'd love to hear from you.
Yeah.
Excuse me, Mayor Van Gordon.
Oh, you're fine. So we actually just had a big conversation about housing and unhoused priorities at council on Monday night. So the task the council's sort of going through is we're taking a combination of normal federal funds that we get anyway, and then additional funds related to COVID or ARP, and sort of just asking the question, what are the other priorities that are out there that we don't have funded today? So the first conversation really was to get everything on a list and talk about what's important to the council and what's important to the community, and then to sort of sparse those out with any additional available resources. One thing I found that Springfield's getting a lot of is we're getting a lot of sort of one-time funds coming in a couple of different avenues, and then and really taking a second to kind of back up and try to make sure we're thinking about this as strategically as possible. And I'll give an easy example. Historically, our Egan Warming Center has been at Everett Memorial, but we haven't, that they need sprinklers. And so one of the priority asks for council was to find additional funds to fund adding sprinklers to bring it up to fire code so that we can move Everett Memorial, the Egan Warming Center back there permanently, so that we have a permanent home in Springfield instead of sort of hustling to find you know, a site every year. And that conversation really ranged between like 16 or 17 different projects. It ranged from sprinklers for Egan Memorial to a permanent bathroom downtown, all the way through a mobile home pilot project. So it will be interesting when we get to go do round 2 of that conversation in a couple of weeks, but there'll be a lot of more information coming out about projects we've prioritized. That's what I had.
Excellent. Thank you, Mayor Van Gordon. And I know Mayor Vince is gone, but I believe Jason Diedrich is going to give an update for Eugene.
Hi, thanks, Brittany. Jason Diedrich, policy analyst in the city manager's office. The mayor sends her apologies for not being here today. She had a public meeting that she needed to attend. So the big news in Eugene, coming out of Eugene, is probably the opening of the Safe Sleep site at 410 Garfield. That communication went out to the media, I think yesterday, and I think many of the service providers on this call probably received that as well. So that spot, we'll have 86 spots indoors that will open on the 22nd. So that's next week. And so we'll begin taking folks in at that location starting next Tuesday. 86 spots there. The importance of that number is that we have around 78 occupied spots currently at WJ, which might equal just a few more people than actual spots. But all of those individuals at Washington Jefferson Park have priority at 410. And so we've been doing extensive outreach at WJ, offering transportation for folks to get from the park over to 410, and then also working with specifically with individuals, either youth or folks there that have pets or service animals, to make sure that there's a location that they can go to. So we've been sort of dedicating a lot of extra care to those specific individuals to make sure that we can accommodate them as well. And so with that, that will bring us to 3 spots overall via the Safe Sleep program and about 200 beds. So feeling good about that. We've got another site at Roosevelt that should open up later this year. That'll be about 20 more beds. And then in terms of Washington Jefferson Park, the closure of that will begin in mid-March, so around March 16th. May not be a full closure at that time, but at that time we'll begin the closure of the park, the restoration of the park, and then the ability for neighbors there to start using that as a park as it was previously. So those are the plans there. That's really the big news, not a whole lot else to share. We are, of course, as I think everyone is, looking for some action out of the legislature, hoping that there'll be some funds coming to our region. We are specifically interested in funds that might help with some things that have been specific to the city's response, a lot of crew time and sort of funding that was associated with our public works department, parks, and seeing if we can get some funding to assist with sort of non-sleep site expenses. So that I think everyone's hoping for something out of the legislature, and that's sort of the piece that we're working on. So that's the update from Eugene. Thank you.
I have a question, Co-Vice Chair.
Yeah. Go ahead, Pat.
Thank you. Hey, Jason, great report and wonderful work out there on Garfield. I've been driving by almost daily. Can you talk a little bit about what coordination may be happening with Lane County on that, Health and Human Services departments, including but not limited to perhaps behavioral health and or physical health?
I wish that I could, but I can't. I will tell you, I have not been intricately involved. That's been much more Peter. Brooke's been a little more involved as well. So we're happy to provide you an update. I think we could shoot an email out to the group and let you know what that coordination has been. So unfortunately, I can't speak to it. So apologies, because I don't know.
Then we'll make a point of getting that information out to the group, because as a project like that does require the coordination with the Health and Human Services in terms of getting services to the people who need services. One wonderful thing about the two projects, 310 and 410 being adjacent to each other, it concentrates people, many of whom do need the type of services that are offered through Lane County. So thanks for the good work, City of Eugene.
Excellent.
Thank you.
And Jason, you might have the same response. There was a question in the chat about accommodating youth. I don't know if there were youth at the WJ Park, and if you do know about that, or if we can get more information about that too.
Yeah, I'll see if I can get you more information. I don't know that it's necessarily a location that will accommodate any youth. I think we're just working with them in their individual circumstance to make sure we find a location that works. So I don't think it's necessarily one place, but yeah, we'll also see if we can get you some information on that as well. I don't think there are very many youth there, so I don't think it's trying to place a lot of folks, but really trying to be specific to the needs of the youth that are there.
Excellent, thank you. Let's see.
I can also share, I see Dan added in the comments that Lane County just recently finished up with an RFQP for housing navigation for, I believe, 4 of the safe sleep sites, and also is working to identify behavioral and or physical health providers that can support the safe sleep sites as well. So certainly collaboration is occurring and working to provide as holistic support system as possible for those in the safe sleep sites.
Excellent, thanks, Kate. Counselor Fleck, I don't know if you or anybody else from our rural communities has an update you want to provide?
Oh gosh, I don't even know where to begin. Our vacancy rate in Cottage Grove for rentals is a 0 to 1%. I mean, it's just desperate right now, but we passed a must-be last year. And oh my gosh, we have got housing ready to be open here pretty soon. We have 3 very large developments going in, several small ones. So that's some good news. We are going to talk about LRPD and affordable housing at a future date. As far as we just had a work session here last week, I believe it was, to talk about homeless issues in our town. Our city is looking at 3 potential locations where we'll use some stimulus money to build infrastructure, possibly contracting with Carry It Forward and or working with Homes for Good to create some level of shelter, possibly a dawn-to-dawn type of situation, or maybe something in the tiny home realm. We're still working out the details. I think most of the council is pretty supportive, but of course, this is a tricky conversation, for rural communities, because this is kind of a new thing for us. And so those are kind of the highlights. And then as a question to the group, is this a regular report? Because I can certainly reach out to other rural communities if you want feedback from them. I'm happy to do that.
Yeah, I think that the idea was to provide a little bit of time for jurisdictions to provide a regular report. So apologize that you weren't warned in advance, but hopefully next month. And again, short and sweet, and know that we want to provide an opportunity for you guys to provide more information. If you have a specific agenda item that you want to put some time aside to, let us know.
Okay, thank you.
Yeah, thanks. Okay. Looks like I am tossing it over to Steve next for a conversation on the Poverty and Homelessness Board financials and kind of a deep dive into our fiscal responsibility as a board.
Yeah, thank you, Brittany, and good afternoon, everybody. This item came up, and Mayor Benna said, talked about it at our executive meeting, and what we're wanting to explore here is to move from sharing the county financials, which are very difficult to decipher, to providing some more clarity to the Poverty and Homelessness Board. But first, I just wanted to say briefly that for clarity, and I know we do this in our board orientation, the Poverty and Homelessness Board is an advisory committee of Lane County. And so all of the financial and fiduciary responsibility of this board lies with the county and the County Board of Commissioners. So I just wanted to clarify that. And for our Community Action Agency and our Continuum of Care, what's required for us is to report on the projects that we're using the federal funding that we receive for those specific projects. So what we're hoping to come back to you with by the next full board meeting is a new financial dashboard. And so the idea is that we would have a financial dashboard that would be more focused by project area and outcome. And that way we can provide the clarity and the transparency and also be accountable. I think the group will appreciate that we all have a lot of familiarity with a lot of projects that we're investing in, and to have sort of the financials sort of parallel those projects rather than the line items in the county budget will be helpful to you. So you can see sort of where we are financially with each of the projects that we're invested in. And the other discussion would be to, originally we had financials not on the consent agenda. So the other thing would be to have maybe some time on the agenda at these full board meetings to report on the dashboard, and so people could ask questions. So that's my report for today.
All right, thank you, Steve. Is there any questions, comments? We're going to come back with a little bit more visually pleasing and easy to kind of comprehend tools for you guys. Okay, thanks, Steve. All right, so now for our main subject today, we're excited to hear a little bit more about the behavioral health update. This again was a request that has come a couple of times from Mayor Venice, and unfortunately the meeting we got it slotted in, she wasn't able to attend, but excited for her to kind of catch up on this. We wanted to do a little bit of an update on the crisis center and then programs for people who are unhoused and workforce development. So we're going to pass this over to Jeremy and Dr. Yochi.
Good afternoon. My name is Jeremy Jalabert. I'm a behavioral health program coordinator at Lane County Behavioral Health. I work on the operations team, and a lot of my time is spent right now on the crisis center. So I'm here to present on that topic, and I'm really excited to be here. And I just want to say I really respect and admire all the work that this board does, and I'm excited to see how all of our work can intersect with this and we can continue to help our community. I'm going to share my screen here. Can everybody see that? We good to go?
Yes.
All right. And then if you have any questions, the easiest thing to do is put stuff in the chat, and then we'll have time afterwards and I can try to answer questions and have follow-up after. So the Crisis Center, our project vision is to open a 24/7 crisis center in Metro Lane County by 2025. And this is supported by our H&HS strategic plan for 21-24. And the main goal is to reduce incarceration, emergency department visits, and hospitalizations for youth and adults that are in behavioral health crisis in our community. The Crisis Center is going to focus on brief crisis support and then transferring those individuals to existing community providers for long-term care. So that wraparound care would happen post-discharge from the Crisis Center, but the center would be the main place where people could get that triage and immediate care. Similar to like urgent care setting for physical health issues, this would operate in that similar vein where people would come in and get the care really quickly, get triaged, diagnosed, and on their way to treatment and stabilization, and ultimately care in the community. Equity is a big foundation for this project, so we're looking at all aspects of the project through an equity lens and ensuring that the access to our individuals in our community will be easy, it'll be matching their needs and very compatible to what they're presenting with and who they are and where they're coming from. So again, 24/7 walk-in crisis service to anyone that's in distress, a no wrong door approach. So a real fundamental foundation of this is that nobody's turned away. You know, they may only need a few minutes of care, or they may need up to, you know, many days of care, but that's no wrong doors. So people can come in, be assessed and supported. A real key foundation is access to the right services at the right time. So as we all know, personally and professionally, as people who are doing a lot of this kind of work, that you can go to different centers to try to get care, but you may not be matched with the right level of care. So if your situation warrants a higher level of care, but you've gone somewhere with a lower level of care, you may be waiting a long time. A good example of this is in the youth system. For youth that are in psychiatric crisis, if they're trying to get care at, say, an urgent care or emergency department, and they need a higher level of care, we don't have very good access to high levels of care, psychiatric care for youth. So they could spend up to, you know, multiple days waiting for care and potentially be placed out of community. So this center for the youth side would actually be able to treat them in that moment, get them care and stabilize up to 30 days at the crisis center versus saying sitting in an emergency department or waiting to go to Portland or somewhere farther. It's going to be trauma-informed and harm reduction focused. So trauma-informed, meaning that staff in the facility will all be trauma-informed so that taking into account the people are in crisis, the environment can be triggering and difficult, and we'll have, you know, soft lighting and comfortable seating and very approachable staff, as well as things like basic fundamental things like food and water and things that people can get immediate support while they're being triaged. So, and then on the youth side, the facility will be very youth-centric and focused and supportive versus looking medical and clinical. It'll be a place where people hopefully will feel comfortable. And then harm reduction, it fully embraces a harm reduction approach. So people will be getting services for all types of crisis, so mental health, substance use, et cetera. So people will be coming in, you know, under the influence, and they will not be turned away. So there'll be a sobering element to the center. We won't be doing full detox. If it's medical detox, we would then transfer to a facility for that and have them come back after that. But for everything that's more in the sobering arena, they will be not turned away. They'll be able to get the care and stabilize into the appropriate unit at the center, and then eventual transfer. So many people have worked on this, and so many different gap analysis work has been done. I was thinking about the earliest I remember hearing about this work is about 2014 with our sequential intercept mapping, which I'm sure many of you participated in. And subsequently, we had another one of those events. But there's been many committees, work groups have identified crisis services lacking in our community and a big gap. Some of those things that have been identified in various committees and work groups are that there's a lack of services for people who are cycling through criminal justice and crisis systems. Some of us know many of these individuals that are just continuously cycling through, and we really want to make sure that they're going to get the care they need and not do that cycling. There's a lack of incarceration alternatives for law enforcement. Something that I talk about often in these meetings and presentations is how impressed I've been with the collaboration with law enforcement in our community and the amount of compassion that all the individuals I've spoken to from law enforcement have for individuals that are in behavioral health crisis. And they repeatedly tell us they do not want to be arresting these individuals. If they can do an alternative, they would. And right now there aren't very many alternatives. An example would be somebody downtown in behavioral health crisis at 3 a.m. on a Sunday. That officer has very little options as to what to do with that person. And so this center, the person would be transported over. There'll be a Sally port. The officer would come in, admit the person over, hand over to the community, the crisis center staff, and be gone within 5 minutes is the goal. And we've consulted with Deschutes County, but we also have some national consultants, RI International, who we've worked with really closely on this project. And that less than 5 minute turnaround is actually very common and achievable. So we see this as a really amazing opportunity for law enforcement to get back out and do the work they talk about. And officers have told me they want to be crime fighters, not social workers. So they would rather be out there, you know, working on crime issues, not psychiatric issues. So this partnership with the crisis center will be really, really amazing. There's a lack of crisis respite. So that's respite meaning places where people can go and just take a break. So we have Hourglass, which is a phenomenal resource in our community. That's 23 hours of respite and recliners. So not overnight stay beds, but recliners. And it's an amazing resource, but there's limitations to how many people can be seen there at any given time. And so we need more of those units. So this center will not replace anything in our community. We'll nest this center within the full crisis services ecosystem that we have in our community and just enhance and bring forward more supports. There's a lack of effective and rapid connection to services. So COVID's highlighted this dramatically in our community, but just getting individuals care to services quickly is very difficult, especially in the last couple of years. There's also a lack of outpatient and inpatient behavioral health and addictions treatment facilities. A lot of our staff comment frequently about the difficulty, especially on the addiction side, of if somebody needs residential levels of care, anything that's more than outpatient, it can be very, very challenging to get people into those kind of levels of care. Even if they're motivated to achieve recovery, there just simply aren't enough of those facilities available. So this facility will not be a panacea, but it will help bridge and help get people towards recovery and supported and triaged in a way that currently there isn't a totally comprehensive way of doing that. And then lastly, a lack of shared data and analytics. So all of our crisis systems use different types of software, different types of servers, and collect data differently. So one of the ambitions of this project is to have a shared data system of some sort so that we can understand it at pretty much at a glance how our data is getting crunched to understanding the crisis system in Lane County. So who's going to access this system? It'll be youth and adults that are in crisis. So in general, that's people with mental health challenges, substance use addictions, but it's also going to include people that have intellectual and developmental disabilities, people who are trauma survivors, people on basically the whole age spectrum. We like to say from toddlers to elders. This facility will be able to treat them, and the staff will be trained and skilled to handle the whole age range. And I want to circle back to the intellectual development disabilities. These are areas and groups of folks who are underserved in these systems. And this crisis center aims to serve many different populations besides the standard folks that we talk about often in behavioral health, which is the severe and persistently mentally ill or addictions. So that's really exciting to be able to include everybody into this effort. The crisis system will coordinate with existing community resources again. So this is going to be having comprehensive memorandums with other organizations and contracts to ensure that people post-discharge continue to get care, long-term care outside of the crisis system, and that we're going to utilize referral pathways from the emergency departments and crisis services and to higher levels of care, so that it'll be almost like an analogy. It's almost like an airport. So people will come there, get services, and go off to their final destinations and back with their community members and family. But that real hub of activity will be really key. And then we're going to offer co-location of services. This will depend on the size of the facility, but our dream is that the facility be large enough that many people, say on this board, in the facilities you represent, could have space in that building to co-locate staff so that people could get the care they need for ease of systems access. So there wouldn't be a lot of delays. Quick overview. So the consultants have crunched all of our data, and they estimated that we need at least a facility that's 29,000 square feet. That'd be 15,000 square feet for the adults, 8,500 for the youth, and then a 5,000 square foot off-unit kitchen, hopefully some acreage, and at least 75 parking spots. So for details, inside the center, the adult unit will be 14 recliners. That'll be 23-hour respite. And then a 16-bed short-term stabilization. So once somebody, say, times out of that 23 hours and they need continuing care, they would transfer over to the adult stabilization unit, and they could stay anywhere from a day up to 30 days. Our average length of stay would be less than 5 days, we estimate. And then, reserving beyond those 5 days for people who are in serious acute need or have really complex cases that require a lot of teamwork and coordination. But we don't want to have everybody staying 30 days. It needs to be a hydraulic system that has ebb and flow, because that will continue the continuity if we continue things moving forward. And the youth unit will be 12 beds for short-term stabilization. There isn't a crisis respite on the youth side, but the unit will function similarly to like a hybrid of crisis respite and stabilization. So youth could come for a few hours up to 30 days. And then again, the law enforcement, that quick turnaround. So officer determines that the crime or alleged crime isn't needing arrest, and they want to move them over to the crisis center. They drive them over, go through the Sally Port, hand them over to us, and then we bring them into the center. So with that capacity, we're only going to be able to serve 42 individuals at a time, but that, again, with a high level of support and staffing and looking at church transfer to community member programs, we imagine that it will be some give and take. So we'll have people in lobby waiting for services, but then people discharging. And the estimate from the consultants is that we would only need to have capacity for 42 folks at any given time. The annual impact estimate is 1,500 youth served and 6,700 youth served, 1,600 adults served annually. That's unique individuals. So some of these folks may be repeat visitors. So, but as unique individuals, that's the total that we're estimating. It'll be peer support heavy. So we'll have a lot of people with lived experience, both peer support specialists and also family support specialists, helping the community members that come in from basically admission to discharge. It'll be woven into their treatment that they're working with peers and getting that kind of level of support that is very unique to the peer support dynamics. There'll be fundamental behavioral health services, so diagnostics, treatment, and what you would expect from a standard behavioral health clinic. But then we'll have co-occurring substance use. So again, treating the individual and all the complexity of what they bring to the crisis situation. Prescriber services, so that'd be MDs and nurse practitioners and potentially PAs and other folks supporting that system. And then a robust staffing model. The consultants estimate it will take about 85 staff to run this, not 85 at one time, but 85 total to run this facility 24/7. And then in terms of impact in our community, what we imagine it will be is less people in jail. So less people that have behavioral health crises in jail, less arrests, less people being victimized in the community, less people unserved in the streets. That's something that I've highlighted in different talks, that just as a, as a Lane County resident, something that I see commonly is people being underserved on the streets in acute behavioral health distress. And it's something that's very, heartbreaking. And I think that the center aims to bring an element of more dignified crisis response, short to long-term care, where people can get that service versus languishing on the street, waiting for services or being underserved. And it's also extremely costly for individuals to go through and access multiple things. So say somebody goes to jail, then gets discharged, gets into an altercation 3 hours later, or is in acute psychiatric distress, goes down the emergency department, maybe gets admitted for a while, gets discharged, gets back there, goes to state hospital. I mean, it's a very, very difficult experience for the individual first, and then secondarily very expensive for our system. And those dollars could be better used in prevention and intervention early on. It's not going to cut any other services. So this program and crisis center is an add-on. It's I said it earlier, nesting into our ecosystem is not going to take away from any other programs or services. And again, the example of law enforcement, that actually what we're learning from consultants is that it relieves systems of like law enforcement in interacting with behavioral health stress, where they can reallocate those funding and amounts to law enforcement and not behavioral health crisis. And probably globally, most importantly, it makes the system more humane, less traumatic, and it's just the right place to bring people there in crisis. The organizational practice of this effort is there's a crisis center steering committee, a really powerful group of individuals who have committed for a long time to see this thing through and have hold the vision to making sure this project is on track and moving forward. Again, our consultants, RI International, provide a lot of expertise and support and recommendations. And then LCBH leads the project management team for implementation. The project has 9 phases, you see on the right-hand side. I bolded the first 5 because that's fundamentally where we're at. We're transitioning out of vision and fundamental project management, and we're very much focused entirely almost right now on securing funding and identifying a site. And then as soon as we do those 2 things, we'll purchase a site and then move into more of the capital projects, fundamentals of architecture, design, construction. Our timeline here, we're on the lower left-hand side. This timeline is got the top part is around sort of the qualitative, so essentially sort of engagement and bureaucracy parts. And then the bottom part is more capital projects, funding and financials. So we're on the site securing and funding side right now. And as it progresses, our goal is in 2022 to have all the funding and the site purchased. And then on the top part in community engagement, which is, we're doing a lot of presentations and stuff. Once construction starts or remodeling, depending if we build or if we remodel, we'll switch, our team will pivot and do a lot more of the stuff in the top part around credentialing, licensing, a lot of workforce and development training. And we anticipate that that item of workforce development will be a huge undertaking. As we all know, there's a national crisis for workforce around behavioral health, and Oregon has felt that tremendously. And Lane County, we talk about this daily around the level of workforce shortage there is. And that is key for us in order for this place to be functional, is to have a strong workforce. And then we'd like to have the center open by 2024. That's the goal. If we had more time, I'd show you these 2 videos. We'll send the slide deck. So I really recommend, if you have time, they're short videos. They really illustrate and paint the picture, and you can see successful examples of the model that we're going to do here in Lane County. And I'll just leave the slide up for a moment if you want to get our info. The main core project team, this is led by Dr. Jihoshi from the Behavioral Health Division. She's our division manager. Shauna Mart is a program manager, and myself. But it's got many, many, many staff. I could list pages and pages of people who are helping support this project and move it forward. I'll close with just, I really appreciate your time. Again, I really see a huge intersection of the work that your board does and the work that this committee is doing to move this center forward. And I'll switch over to the chat, and I'll also see if any of my colleagues are in the house too.
Excellent. Thank you, Jeremy. I appreciate that. There is, looks like several questions in the chat, and then some folks who have their hands raised. So I can go ahead and look at that queue. Commissioner Farr, if you want to go first, and then I see Julie has her hand raised, and then we'll jump over to the questions in the chat.
Thank you, Brittany. Jeremy, great presentation. We heard some about it at the mental health summit this morning, and Dr. Jihoshi talked a little bit about timing and about coordination with other agencies. My question is, one of the largest affected agencies, of course, is the Sheriff's Department. Right now, the Eugene Police Department, their default is the jail when they have a situation where somebody needs to be taken off the street for whatever reason it may be, and the jail, of course, is fully occupied by circuit court cases. So my question, Sheriff Harold is a member of the Poverty and Homelessness Board. Sheriff Harold, you've been in discussions on the crisis center as far back as I can remember, 6 years or more, since before you were even potentially the chief deputy. Can you talk about how this is going to impact the jail, and how many cases per day, for instance, do you anticipate being relieved of as in your the Sally Port and Bucking area of the jail? I will also mention that a number of people on this in this committee have visited the jail recently, and they understand that the jail is actually serving as the largest behavioral health facility in Lane County. So, Sheriff Harold, can you answer that?
Yeah, you bet. Appreciate it. Super excited about the progress that's been made on this. I have been attending the Mental Health Summit for many years, along with our jail commanders and our enforcement commander. And needing to have this sort of resource. And Chief Skinner from Eugene Police and I were recently in a meeting. The reality is that the folks, the patrol folks, whether it's Eugene Police or the sheriff's deputies that are out in unincorporated Lane County, or the Cottage Grove police officers down in Cottage Grove, they get called because a community member has a problem and they need somebody to provide a solution. And we need to make sure that there's a solution available that doesn't always include jail. So oftentimes for folks who are really in a mental health crisis, bringing them into the very controlled environment of the jail, having them addressed, even though I'm super proud of the deputy sheriffs that are working in there, I think they do an incredibly good job. They are wearing a uniform just like mine, and that isn't always the best interface for folks when they're in mental health crisis. So to be able to provide the folks that are out there responding to calls a different solution where they can remove the problem, if it's a business owner that has somebody disrupting their business, they could solve the problem at the scene, but potentially in a much better way than jail for a trespass charge. A facility that is designed really around treating that particular person in their crisis. And then I'm really excited about the ability for it to transition from that 23-hour thing into a stabilization center for a few days. Sometimes we see stabilization in the jail, but it would be so much better an environment in the crisis center. Stabilization and then a handoff, hopefully, into some other program that can walk alongside of this person and help them avoid the situation that brought them in the first place. And I don't want to do too much talking because I know we're limited on time, but one other thing that I'm excited about, we talk, multiple times a week with family members who are walking alongside a loved one who is in mental health crisis. And the family members are so frustrated because they want so badly to help their loved one stay out of jail. But they just feel like there's no answers. And so I'm excited about being able to tell a family member, hey, if you're able to negotiate with your loved one and get them into this 24 hours a day, you can walk into this center with trained individuals who can help you out with your loved one, again, before they have a confrontation with the police, before they end up having to have a police resolution. So I'm excited about that. I have some neighbors that have reached out to me a number of times about their adult child who is struggling, and this is I'll be able to give them a resource that's been lacking. So this is exciting stuff. We've been a lot of people working on it for a long time, and it's fun to see us making some progress.
Brittany, Sheriff Howell, thank you very much. That was a great response. I know you could go on for a long time talking about the impact of virtually every other system, but Brittany, I'll pass it back to you. I know Jacob Fox has a good question in the chat. Thank you, Sheriff.
Yeah, thank you guys. I guess they put us in order. So my hand went up next after that. I have a question about, so you said you're kind of moving out of the visioning phase into the site selection and purchase phase. And I'm curious if you can talk more about what that process is going to look like. I think that really great intentions can be sidelined without also a great process for locating something like this. And so I'm anxious to kind of hear about how that's going to work.
Yeah, our consultants have estimated the facility will cost about $19.1 million. That estimate is looking at either building from scratch or remodeling a building, but they have also indicated that that estimate needs to be taken in the context of our current COVID environment, supply chain and workforce shortage. So they said that we should think about it in 19.1 million plus or minus 20%, depending on the situation with workforce and cost of construction materials. So we have started working with our internal real estate and capital project teams. We've looked at some facilities virtually, and we've toured one facility or one building recently that was very exciting. So it really largely depends on where we find a place where that could be suited for all of what we need. We also want to be cognizant of where it's placed and the neighbors surrounding that and their feelings, pro and con for that. We anticipate and think that regardless of where we are placed, that it will be a actual very value added to communities, because it's like going to bring, as the sheriff talked about, a place for somebody to go versus, it doesn't need to be on the outskirts of town and be stigmatized. This is a place of wellness and recovery. And so just on the practical side, we're in fundraising. We've raised about 42% of those $19 million. So we're essentially moved out of that visioning into pure fundraising, grant writing, collaborating, coordinating with all stakeholders and partners. And, that's really where it's at fundamentally, is around fundraising and making this vision and dream come true. I think we have one grant pending right now for 1.7 million, which we should find out about in March. And then the remaining dollars, if we get funded, we're going to piece it together and make it happen. And that'll determine, again, how quickly we can purchase and remodel as well. But again, we hope to do all that in 2022.
Excellent. Yeah, the timeline that you mentioned, I assume it was chronological, but I guess I just sort of feel like there's community engagement before a site is selected. I feel like it's the biggest piece of advice I can give you, given our history of how these types of projects have gone. So I just am excited to see this moving forward.
Yeah, we're definitely going to follow the lead of, whatever part of Lane County, the commissioner from that area and all the stakeholders and people invested, we'll work closely with everybody. So we'll be following the lead of all of the community members and leaders wherever the proposed site is and be very respectful of that process.
Yeah, and I can also speak to that we have plans in place around as we're touring different sites, getting stakeholders involved at, the first set of questions are really around, could we make this site work both from a functional standpoint and a financial standpoint? If those things appear to be positive, then we begin to bring more and more stakeholders in. I think we will not close a deal without there being a tremendous amount of community input around the specific site. So I do want to give confidence at least to that piece.
Excellent, thank you. Julie, and then I'm going to jump over to the chat.
Thank you, Jeremy, for the thorough and really interesting presentation. I wanted to know, is this available online or could the group get a copy of it?
Absolutely. When I drop out of the call, I'll email this group the slides if that's helpful, for sure. And you're also, everyone here is welcome to contact me and Shauna with any follow-up questions. And if you have a need for presentations in other groups or just want to talk one-on-one, we're really here to support the community on this. So definitely. And I'll send those slides. And again, I want to plug, please watch those videos because they really do illustrate and illuminate, at least for me, when I saw the videos, it all came together and said, oh, they're going to be amazing.
Thank you.
So I think that Sheriff Harold might have touched on this a little bit, but there's a question in the chat. Law enforcement will be using the crisis center as an alternative to jail for those with mental health issues. Those folks may be remanded to stay there for a while. Will the center be ready for that? And is that an expected kind of relationship?
Yeah, so my background is in clinical social work and forensics. So I'm really familiar with the complexity of what they're describing, and where we were concerned about that at first in the project, thinking about how we're going to do this. So the center will be voluntary. By and large, people coming in, it's voluntary. We're working out the details of how we have civil commitment investigators that will probably be partially there at times to do civil commitment investigations, but that's a very formal process that requires a lot of oversight. And so it's not going to be the key component of the crisis center. So the ability to remand people will be limited. I think that will be part of the discussion with law enforcement will be if they're dropping somebody off that is extremely volatile or needs, extra levels of support, what the agreement would be maybe for waiting a little longer. One of the very encouraging things when we consulted with Deschutes County was they found that by and large, the vast majority of people didn't require any kind of remanding because once they got transferred over and they realized, hey, I'm not going to jail. The folks I'm being transferred to, aren't gonna, this isn't about law enforcement, this is now behavioral health. And the kind of surprise of being transferred from a law enforcement setting to a behavioral health crisis service setting actually has calmed a lot of people down, and they transition quickly over to being de-escalated. And it sounds like a dream, like how's that really possible? But everybody's telling us on the consultant side that it really does happen. And of course, there'll be unique situations and difficult outcomes at times and things we can't predict. But it sounds like from talking to consultants that there won't be very much need to remand people, and that won't be the focus of the center.
Excellent, thank you. I think you maybe mentioned it after this question was asked in the presentation, but how many beds or clients will be served? Can you remind us?
Yeah, 42 total, and breaks down by the respite side and stabilization, and there'll be crossover between that in terms of people transitioning back and forth.
Excellent. And someone asked about branches of the crisis center in Springfield or other locations in the rural communities.
Yeah, so we talked about this a lot with the committee level, and right now this will be essentially the mothership crisis center, the signature flagship, as you will. But we have brainstormed a lot of different ideas around this, and we absolutely want to serve rural. The challenge I think we all have in all of our service delivery models is how do we serve from the mountains to the coast effectively? The way that we're envisioning this one, will have a staff member with the secure transport ability to potentially meet people in rural communities and transport, or meet them halfway, or meet law enforcement halfway, or some creative solution around being able to serve and bring people to the center. That part hasn't been fine-tuned yet. The other option would be later down the line. So say this the project is really successful and we have this huge need in rural areas. We talked about having satellite versions of this. So, you know, the mothership and then these little miniature spaceships essentially, you know, placed all over the county, and then they could all convene and use the network. But, you know, we don't have, that's all vision quest. We don't have the finance right now to do that. But that's the idea essentially of serving rural. And then again, people who live in rural and serve rural communities, I would love to, for people to email us and give us their ideas, because I'm not an expert in rural mental health. So.
Great. Jacob Box asked a question that was running through my head too. How is this being communicated and coordinated with Peace Health? I know that they have their university district and their behavioral health services there.
Yeah, so we're there, that worked into the committees in terms of really discussing how that relationship will work. So it's all in discussion and figuring out, you know, what would that look like, and you know, and we're not at the point yet in terms of really the real detailed level of like memorandums and understanding of, you know, if somebody had a certain condition, where would they go? Some of the discussions right now are around medical care and what are the capacity and limitations of the center, and what could we effectively fund as far as medical care. And that would be an example of needing to really do a lot of coordinated care with Peace Health and the behavioral health unit. But we imagine, and I saw there's another thing in the chat around coordinating cahoots. The vision of this is that we would be deeply connected with all of these, you know, stakeholders, you know, large and small, and we would have really good working relationships that would just be synergistic. So people would be transferring over, cahoots would be dropping people off. You know, it would be a very, I think, important fitting a need in our community from that perspective.
Excellent. And on the topic of coordination too, Debbie asked about the mobile crisis response RFP for South Lane that will duplicate the mobile crisis pilot completing in Florence.
Yeah, I haven't worked closely on those projects. My understanding is that the Florence project was a success and it's getting replicated in Cottage Grove, but I can't really speak to the depth of that one. I know that as far as the crisis center goes, we'll be having strong relationships with those providers in terms of being a place where they could bring people. Mm-hmm. But yeah, I don't know if any of my colleagues are on the call that could jump in, feel free.
Dr. Foster also asked about the ongoing operational costs, if that's been calculated.
Yeah, so the consultants, when they crunched all the data, they estimated that the operational cost year one will be 15 million for baseline, just foundational expenses, with the 16 million revenue. And that estimates having 70% of those served having Medicaid, and the remaining 30% a blend of, you know, uninsured, Medicare and other. So it's like all behavioral health systems, it's largely dependent on fee for service, which we're increasingly seeing, and I think the pandemic has shined a gigantic magnifying glass on limitations of those kind of funding structures, because it depends largely on being fully staffed and then operating essentially at full capacity and full billing, which in a crisis setting isn't a very good model, because crisis work takes a long time. It's very nuanced and fragile. So, but just from a foundational estimate, you know, from consultants that have done this in many different parts of the US and the world, they're saying that 15 million expense, 16 million revenue. And they've given us a 3 to 5 year estimates, but they all break even budgets. So we've been talking to them more about, you know, this system, especially with inflation and what we're all seeing during COVID and everything's so much more expensive. you know, what's the realistic way to sustain this center after year one that isn't just breaking even and barely making it.
Yeah, thanks for that. All right, looks like Richard, you have your hand raised.
Thank you. No, I'm not a voting member of this body. I did appreciate that. Yes, a lot of folks that are unhoused get discharged from the hospital or whatever with medications that they need to take, and because they're in this survival mode situation or under mental health crisis or trauma, they're sometimes not doing so or not doing so properly, or and I was wondering if there could be part of this center where somebody that is unhoused could drop in and, you know, get their medication so it's taken properly. And in that light, if you get my meaning.
Yeah, I absolutely 100% know where you're coming from. You know, I worked with a facility in San Francisco, and what you described exactly what we experienced, you know, continuously. And I think the vision would be that we would have an ability to serve people as they need issues like that. So knowing they're going to come back and need help with their medications, whether it's physical health meds or psychiatric meds, and that they'd be well known by the staff and they would have an ability to come get some medicine. It's not an outpatient clinic, so we'll have to walk that fine line and figure out what is the way we can balance the needs of the community with what the individual presents as. But I'm imagining there'll be some component, some ability to keep the continuity going, so that individual isn't going to say, go to the emergency department every 3 days to get a refill or support. You know, that we ideally come over to our center, we would know them, we'd help them refill some meds, get them ideally connected back to services. And again, if our facility is big enough, we would have co-located teams of all types beyond the crisis center to do that long-term care. So like if they were forensically involved, we have a forensic intensive treatment team from Lane County that they would link up with, say, and they could be getting that long-term care. So it's a great vision, and I think it's achievable with the amount of resources that, if the proper resources are allocated.
On that topic of resources, Danielle asked if the consultants or the report had any other recommendations for supportive services outside of the crisis center that needed to be in place in order to make the crisis center successful.
Yeah, they haven't issued our report yet, so we'll get a report sometime in the next 6 months, we think, just with that kind of final analysis of what we need. Just anecdotally talking to them, and then also visiting a center a few years back in Denver that had some of these similar components. The success comes from the care coordination and teamwork across systems. So that means, you know, really coordinating and having all the nonprofits, the hospitals, the county, the city, everybody working in one direction and fully committed to serving these individuals and getting them long-term treatment. Some of the strengths in other communities is that they have full jurisdiction over all of those entities. So like some of these centers have, you know, they're the crisis center, they're the outpatient, they're everything. So they can kind of have all the shared staffing and do a lot more coordination. Our model doesn't have that. So it's going to take a lot more agreements and MOUs and contracts to ensure that that level of continuity occurs. But what I've been really impressed in my time in Lane County is the level of commitment everybody has to doing the right thing and treating people with dignity. And so we anticipate that, you know, just by bringing the center in, that will plug right into all the amazing systems that all of you work through and all the other behavioral health and medical setting, and really figure out how we fit and how we complement the system and not replace anything.
Excellent. Mayor Venice?
Yeah, thank you. First of all, my apologies. I had another meeting, and so I ran late, and so I'll have to watch the recording of your presentation. And so thank you for being here. And I apologize for missing it the first time around. And I may be asking something that you've already covered, in which you could say, just watch the presentation. So I'm so interested in how this fits in the network of services, and really appreciate all your comments about the connection with the other providers. I mean, I think it's very exciting. It's really so much what we need. I am wondering about the state's role in this, and a little bit wondering about the state psychiatric hospital, and whether there's a link there in terms of strengthening support or patients who come in and actually need that sort of longer term services. Could you? I don't know if you spoke to that or not, but I'd love to hear that.
Yeah, I didn't speak to it in depth, and my understanding, I work mostly at the local level, so I don't have a whole lot of knowledge about the state part of it. But I did work at the Oregon State Hospital years ago, and watching the cascade of people discharging to the community that are higher acuity, and the community needing to then treat people that are higher acuity and get them care. So I think that people that work with me and above me are definitely working at the state level and coordinating and determining, both at a financial level and looking at, is there ways the state can better invest. Our Alex Kyler, who works with all of the intergovernmental relations, is doing a lot of amazing work on coordinating at the state and federal level, the emphasis of how important this project is. So in the last 3 weeks, I feel like a lot of momentum has occurred. It's starting to snowball. A lot more people are getting involved because we've now transitioned out of that vision into just pure fiscal and financial fundraising. So I think as that progresses, there'll be a lot more coordination with the state. And then as we transition after we purchase the building or build, there'll be a lot of that on the timeline I showed earlier, where the top level of all the more bureaucratic elements. We'll be doing a lot more coordinating with them towards licensure and seeing how this fits into the bigger communities and how the state is investing in it. I'll say just my knowledge and looking at state level stuff, and I looked at some stuff a couple of days ago, it all aligns with everything they're describing and all these big major reinvestments in the behavioral health. So we're hoping that this just plugs right into that. And then as we get more information, we can share more too, as we get more concrete details.
That sounds great. And I have just one other sort of follow-up question, which is maybe really off a little bit, but I'm very interested in how we create a workforce in this community around people who can do that sort of social work, counseling, clinical counseling. And I don't know whether there might, if that's envisioned, if there's a capacity for, as this crisis center gets established, that it can become part of that sort of, how do we bring people in, give them skills, internships, connections with teaching institutions. It may be a little early to ask that question.
No, it's absolutely, and it's on top of everybody's mind, and it's on our timeline. We're committing probably 2023. We'll probably be spending a majority of that year working on just that topic alone, because it's such a big deal. I've been in meetings this week where programs are talking about shutting down services, reducing hours, just purely because there's not enough workforce. At behavioral health, we have, I think, at last count, we have 20 openings that are very difficult to fill. Even with increasing wages, there's still real challenging recruiting. So we're going to talk to the state. Also has invested in a lot in workforce, and so we're trying to figure out how we can tap into those resources and funds. And our consultants have talked about the way they've dealt with this nationally is high salaries, recruitment bonuses, retention bonuses, high levels of overtime payment, training and education dollars, loan repayment. So it's going to take real programs like that, especially as we try to recruit folks that may be getting better offers in larger metro areas, and then hopefully, if housing could be more affordable in our community, people fresh out of school might be able to move here with a loan repayment and a high salary. We could start maybe incentivizing and people on more. We have had experiences where people are just simply getting recruited by places that can just offer, a lot more money, and that's sad, but it's kind of where we're at.
Excellent. Thank you all. And Kate, I wanted to make sure, was there anything missed on that agenda item, programs for folks who are unhoused or workforce development? I think Jeremy touched a little bit on that, but I didn't know if that was a separate agenda item.
Well, I wonder if Dr. Gioshia joined us today.
Don't think I see.
She
her.
may have not been able to get away. Which is okay, because we certainly spent an excellent amount of time on this conversation, which was needed. So I'll look to invite her back in a future meeting.
Okay, that sounds good. Well, thank you so much, Jeremy. We really appreciate it, and look forward to getting those slides so we can do a little bit of our own research on those links that you provided as well. So appreciate it.
Absolutely. I really appreciate your time, and really, again, want to reiterate, I really respect all the work this board does and look forward to more future collaborations. And we'll be happy to come back. Shauna and I do a lot of the presentations. She's on vacation this week, but if you want regular updates, or if you have very specific things you want us to report back on, we'd be happy to collaborate. And then again, reach out if you have any questions, or if you'd like to consult and talk with us one-on-one. We'd be happy to touch base. So thanks again.
Excellent. Thank you. All right, we have a few minutes left in the meeting. We want to leave time for public comment. If there's anyone from the public who wants to participate, if you can put your name in the chat box, we can give you, or raise your hand, that works too. All right, I see Tim, and I'm going to let other folks who might have a comment, please make sure you put your hand up or put it in the chat. So go ahead, Tim.
Hi, thanks. I think people might have seen that cold weather's coming, so just a quick update. Right now, it's going to get dramatically colder between Sunday and Tuesday. It's supposed to be down even as low as 20 on Tuesday. So Egan could be open Monday through Friday or longer, or Tuesday through whatever. So we are preparing. It's going to be even more of a challenge this time. The Oregon Logging Conference is all next week at the Lane Event Center, so that is not available to us. So we are trying to figure out how to use a couple of our older outlying sites, Trinity United Methodist Temple Beth Israel, which means we're also trying to get 3 shuttles and enough drivers to be able to help get our guests to and from, and perhaps use that area behind First Christian Church for that again. And Cheryl, thank you, has offered some space at the Mission. I'm going to go take a look at that this afternoon to see if it might work. Even if it's small, it's certainly a better location, located closer to where our guests are. So everybody's been wonderful the last 2 activations, offering help, and we appreciate it. And I won't be shy about asking. That's your quick update. Thanks.
Excellent. Thanks, Tim. Any other comments? Public guests who want to share? Okay, wonderful. All right, so we made it through winging it again. Another meeting, and appreciate you guys and your patience. We had a lot of great information. And yeah, Commissioner Farr, did you have a comment?
Just from Chris McAllister, he apologizes for not being here this morning, has monitored and has followed the meeting. So Chris is infirmed at this point in time, Co-Vice Chair.
We hope that you get well soon, Chris, if you're watching. Kate.
If I may, I'd like to share a few upcoming trainings or opportunities to share feedback. One being that there is a listening session planned for February 23rd from 9 a.m. to 10 a.m. with a focus on higher level administrators sharing with the county how resources that have been allocated through ARPA funds can help support with capacity building within your agency. And so if you're interested in being a part of that, just RSVP with Diana Aldridge and she'll get you that invite. If you're not able to attend and someone from your agency cannot, you're also welcome to send feedback via Diana, and we'll make sure to include that in the information that's being reviewed. There's also a fantastic COC orientation and refresher training that's being planned by Amanda Borta starting on March 7th at 2 o'clock to 3:30 p.m. And so there's a sign up on the agenda if you're able to attend that. Great information and really helpful to understand kind of what is one of the main purposes that we have here as we use this vehicle to move our continuum of care planning forward.
Excellent, thank you. Any other last minute announcements? All right, our next meeting of the executive committee is March 17th and then April 21st for our full member meeting. Thank you, everyone. With nothing else, I will go ahead and adjourn.
Thanks, Brittany. Bye.